Hey everybody, it's Dr. Falcone from Dignity Integrative Health and Wellness. Hope everyone's having a great day. Hope you're enjoying this wonderful summer weather. We're certainly having heat, certainly in the East Coast, in the DC area, close to 100 degrees today and tomorrow. And I know out west they're having even greater heat and in the south. So I guess we should be thankful that it's only 100 as opposed to 110 or 115, which some areas are experiencing. So stay cool, hydrate, make sure you're staying safe, make sure you're wearing your sunscreen. And if you have an opportunity to take a dip in a lake or in a pool, take advantage of it. Now is the time of year. So we'll get started, talk a little bit about insulin resistance in a minute. Just wait for folks to kind of pop on, whoever's going to pop on. And then we'll talk about this really important topic in just a minute. So it's got a little bit of time away, so I was off for a couple of weeks, which was very nice. Had some family time, good for your mental health, although sometimes being with 12 or 13 other members of your family has their moments. But we all enjoyed time at the beach and relaxing and just cooking family dinners together and really enjoying the time together. It was actually a really great time. We ended up spending some time in the Outer Banks, which was absolutely beautiful, and we had some beautiful weather for it. So I wanted to talk a little bit about insulin resistance and why it's so important as part of your overall health. You know, at Dignity Integrative, I like to talk about, and I've talked to a lot of groups, community groups, business groups, about kind of what drives overall health and what drives longevity and what is called health span, which health span is the concept of living healthier longer, because we all want to make it into our 80s, being able to do all the things that we do today, right? Be active, travel, do the things you want to do, play with your grandkids potentially, and just be really active and fully functioning people. And that's really the intent is, you know, what do we need to do? And we talk about the 4 pillars of nutrition and movement and sleep and mental resiliency as keys to that. But there's something that kind of underlies a lot of this whole health and longevity science. And one of the key concepts is something called insulin resistance. So insulin is a hormone. It's produced by your pancreas, which sits just behind your stomach. And its job is to really regulate your blood sugar. Most of us know insulin from people that are diabetic, that are taking what's called exogenous insulin from outside your body that they have to inject because their pancreas has either been either shut down or over time has produced so much insulin it's not able to keep up, and we have to give extra insulin. So that's where, you know, most of us that aren't medical people know about it. But insulin is a hormone, and it does a lot of things in the body. And this concept of insulin resistance has come into the literature in the last 20 or 30 years. And it's this concept that in order to maintain a stable blood sugar, and a stable blood sugar for most of us is under 100 milligrams per deciliter, which is the measurement. So when you get your blood drawn, and your doctor sends you usually for a fasting blood sugar first thing in the morning before you eat, you want to see that level's below 100. And there's certain breakpoints. Between 100 and 125, you're considered pre-diabetic. And over 125 or 126, you're considered to have diabetes on a fasting insulin or fasting blood sugar level. That's provided you're not sick, and there's a lot of things that can raise your blood sugar. But if you're just getting your blood drawn and your doctor has a blood sugar of 109, then you're technically in the range of pre-diabetes. So what are the numbers associated with that? So we know, according to the CDC, that 40%, that's 4 out of 10 of all Americans have diabetes or pre-diabetes. Think about that for a moment. There's like 360 million of us. So 40% have diabetes or pre-diabetes. And 50% of those over 65 have diabetes or pre-diabetes. That means that you are at risk for a lot of chronic medical conditions, because we know that an elevated blood sugar increases your risk of cardiovascular disease, increases your risk of cancer, believe it or not, and increases your risk of dementia, which some people are calling type 3 diabetes. So why is that? So let's get back to some statistics that the World Health Organization says 80% of all chronic disease is preventable. Think about that for a moment. 40 to 50% of Americans are diabetic or pre-diabetic, according to the CDC. And 80% of all disease that we have, all chronic disease, is completely preventable. Those are staggering statistics, completely at odds with one another. So what does insulin have to do with all of this? So as I said, insulin is produced by your pancreas. And insulin has one specific job. It actually has multiple jobs, but the one we most commonly think about is it drives blood sugar into your cells. So your body does not like a high blood sugar level. So that 100 number that we talk about, you try to basically keep that, hey Teresa, I'm gonna wave back to you. You try and keep that blood sugar less than 100. So you produce insulin to do it. So you actually produce insulin, your body produces insulin, actually even before you have a meal. Even thinking about a meal can actually start to increase your insulin level, which is kind of interesting. So the whole mind-body connection is real. So what happens when you eat is your pancreas pumps out insulin and it drives blood sugar, glucose, into the cells, into your muscles, into other cells to keep the blood sugar of your body below or at 100. And that's the challenge, is over time, the concept of insulin resistance means that the more and more calories that you take in, the more insulin your body needs to push out to be able to keep that blood sugar below 100. So we call that insulin resistance, because you're resistant to the normal level of insulin. So there's another thing that insulin does, and it's not very well known by most people, certainly most lay people. So insulin will do two things. It will drive blood sugar into the cell, and insulin will also tell your liver to produce more fat. Fat in the form of what are called lipoproteins, which for those of us that get our blood tested and are over a certain age, lipoproteins are like HDL and LDL, and they're cholesterol tests, right? So insulin does both of those things simultaneously. It drives blood sugar to keep that blood sugar low, and it also tells your liver to produce lipoproteins, to produce fat. So why does it do that? Well, remember, the job of insulin is to control the overall blood sugar. So you want to drop it in your bloodstream, and you also want to tell your liver to take those glucose particles and put them into a long-term storage so they're not affecting your blood sugar. And that means it converts them to fat. So most people don't realize that insulin does those two things, and I actually wrote about it in my blog called "Are You a Glutton or a Sloth?" And one of the reasons I'm doing this this little educational session is because I got quite a few reach outs from folks that were saying that was a really interesting way to look at how we take care of our health and from a nutritional standpoint. And we're always talking about nutrition because that is the base of how people stay healthy long term. So so the question is, so what? So your liver produces a little bit extra fat, it sends it out, and eventually it's stored as more fat in your body. What's the big deal? Well, we know today that it's not just an inactive organ or inactive cell, these fat cells. They're actually metabolically active. And what does metabolically active mean? It means they're actually sending out their own signals to the rest of your body. So those fat cells, those adipose cells, which are what fat is called in medical terminology, actually sends out signals to the rest of the body. And unfortunately, most of those signals are inflammation. It sends out interleukins. It sends out tumor necrosis factor. It raises what's called your C-reactive protein. And that's one of the baseline tests that when you come to my practice, those are some of the things that we measure. We actually will measure your fasting insulin level, which should be below 10. I had one patient whose fasting insulin level was over 30. It was over three times the normal amount. So again, the higher your insulin level, the more insulin that's floating around in your body, the more that it's telling your liver to produce fat. So what causes insulin levels to rise? Well, insulin level rises in response to a lot of different foods. So it can rise in response to carbohydrates, which are, the typical things of breads and pastas and rices and sandwiches and chips and all the things we fortunately or unfortunately love to have. It rises in response to protein, and it rises in response to fats. So those three big macronutrients all increase insulin levels. So which one do you think increases your insulin level the most? It's carbohydrates. It's basically those things that are quick to digest, that cause the strongest swing in your blood sugar. Insulin has the highest release because of those, because it wants to get that level down as quickly as possible. So if you take a meal that's primarily based on fats versus primarily based on carbohydrates, you're going to see less than half the rise in normal insulin levels. So that is kind of remarkable, right? So is this saying that all of us should be ketogenic diets and not have any carbohydrates? No, I wouldn't say that. But the reality is that we were told for years and years and years to eat a low-fat and unfortunately higher carbohydrate diet. And the result of that is higher insulin levels, more insulin resistance, more fat production by your body, more inflammation by your body through all of those things that we talked about. And that inflammation, is bringing it all kind of completely around, is what causes those chronic diseases like diabetes, like dementia, like even cancer. 60% of all cancers, they think, could be related to inflammation. And inflammation for people that are overweight or metabolically unhealthy, we know that they have higher levels of inflammation and certainly cardiovascular disease, heart disease, strokes. We know people that are metabolically unhealthy have much, much higher risks of it. So it's interesting that that this whole concept of insulin resistance, it's a difficult concept to understand, but it does kind of all fit together with how you stay healthy. There's some people now that are proposing, even for people that are normal blood sugars or not diabetic, to wear what are called CGMs, continuous glucose monitors. Haven't quite made that leap yet, but there is emerging science, I won't say good science, that people that keep control of their blood sugars for longer periods of time and conversely keep their insulin release as low as possible, actually stay healthier longer. And that science is emerging, and we'll see kind of where it goes. But there are people that are now, putting on continuous glucose monitors, even if you're not diabetic, and monitoring their blood sugar as they go through the day, depending on what they eat and seeing what they do. So this concept of insulin resistance is connected to metabolic syndrome, and that's kind of the first step as we move along the lines of chronic disease. And there's actually criteria for metabolic syndrome. So there's a really sophisticated test that you can do. You take a tape measure and you measure your waist circumference right around your belly button. And for a man, if you're over 40 inches, or for a woman, if you're over 35 inches, that puts you at higher risk. If your blood pressure is over 130 without medications, that puts you at higher risk. If your triglyceride is over 150, that puts you at higher risk. And of course, if you have elevated fasting blood sugars, then that would put you at higher risk, and that would meet criteria for metabolic syndrome. And we're finding that more and more people are falling into that category, and that's a step in the process that increases your risk of chronic disease, that increases your risk of certainly diabetes, but certain cardiovascular disease, cancers, dementias, chronic kidney disease, chronic renal disease. Those are all the things that 4 out of 10 Americans have one chronic disease, which is staggering. And 6 out of 10 Americans have 2 or more chronic diseases. And that's according to the CDC. So this concept of insulin resistance, while it's a little bit complex, it's important for you to understand when you're, and for you to ask questions about your doctor, like, should I be checking my fasting insulin level? Should I be having my lipid profile checked on a more regular basis? Should I check inflammatory markers like C-reactive protein? Those are all tests that I do at Dignity Integrative as part of your initial evaluation, because we have to establish a baseline. And then through that baseline, we build your plan along those 4 pillars of nutrition, of movement, of sleep, and mental resiliency to really get you to a state of better health. So I just want to talk a little bit about insulin resistance, what it means. Would love for everyone to continue to follow my blog, ask questions in the chat below on Instagram and Facebook, and definitely if you have any questions, give us a call, and we'll be happy to have a 15-minute no strings attached consult to see if you would benefit from an integrative health visit and evaluation. So I want to talk a little bit about insulin resistance. Hope that clarifies some things for folks. And until we meet again, be healthy, stay cool, and be kind to one another. Take care, everybody.